bring this across your chest and rotate it down.
Yeah, that hurts.
So that's called the Hawkins Test. So the Hawkins Test is really specific for impingement syndrome, which this injection helps out with a lot.
Okay.
So I've got high hopes for this working out.
Okay.
So let me get everything I need. Oh, I forgot to get my Gawayne solution, the topical numbing stuff.
Yeah, people like to be numbed.
People like to be numbed. It's smart. So let me get everything out that I need here. So we rolling.
Oh yeah, we're rolling.
Rolling.
Getting hearts already.
Getting hearts.
Here, I'll show him. See, when people like it, they tap the screen and it makes little hearts come up.
So
And they're different colors according to which person it is. Yeah, we got 13 people already watching.
All right, so let's see here. I've got that,
14.
that. I need the Gawayne's.
And when they make comments, we read them. Somebody says, ah, I'm not sure what ah means. How's your mom doing?
Everybody's always asking about your
Everybody's
mom.
asking
I'm
about
gonna be right
my,
back.
my mom went to the hospital this weekend, and I showed the whole experience we had in the nurse department, the workup for chest pain, so people were very concerned about her on this, and they're writing that they're wishing her well and praying for her.
Wow.
Yeah, my mother's fine, by the way, everybody. And she appreciates all your well wishes and your prayers. So on this gentleman here, we are working on the shoulder, and we're going to be injecting. I feel the prominence here on the back of the scapula, and go down.
About 1 to 2 finger breadths.
Yeah, right there where there's a little fossa, you can kind of feel it with your thumb. And then I put another finger over here at this. Oh, I'm sorry, I'm not even showing you. You guys should tell me. This bump here, this prominence here is where the clavicle comes to meet the acromion, the AC joint as we call it.
So I'm gonna find all those areas.
And the reason I put my finger there is because that's where I
That's where you aim.
That's where you aim. That's where you point
I
your
always-
needle toward.
And now you just want to be a slouch. It's not that often you
You
get
wanna
told
be a
that, so live it up. So you find like the angle of the acromion here. Put your thumb under it. This is how I do it, and I do it right under that. And
So
you can see it dips in nicely. That's right where. And then you got a dry brand there, as we call it.
And one patient says she had a cervical epidural, meaning in the neck, last week, and you should do great with this. I agree.
Yes, compared to a cervical epidural, yeah.
Compared to the spinal injections, this is nothing.
Yep.
So you do that with your pen to make a little temporary mark there, so
Yep.
you know exactly where you're going.
It doesn't get rubbed off or with the alcohol.
Like mine with the pen do.
Exactly. So that is nice and clean. Let me get my gloves on here.
That's this spot. That's where we're going.
That is the spot.
Cool way to mark the area. How long is the needle?
Should we say that from the patient?
We'll show it to you, but not the patient.
No, it's not that one.
Is it in your pocket?
It is.
It won't
there
fit
it
in
is.
there. It won't fit in his pocket.
There we go.
That's right.
Of course,
Let me pull it out of my pamphlet.
this thing does not focus real close, but
So I'm going to use this
it's in relation to my finger.
Gawayne. So this is just some cold topical numbing spray.
And then
So it
That's
kind of
the,
numbs up the area.
cortisone inside.
So
He hasn't pushed all the air out yet. But
Yep.
he'll get to that. Oh, this part.
So this is just topical numbing. It's cold. Kind of like putting, ooh, you can see it kind of nice up there. I guess it's kind of like putting ice behind your ear before I have it.
Before you.
I don't even do that anymore.
Oh, come on in.
Let me get a whole.
Oh, room one. Oh yes, I'd be glad to sign this.
Little poke. And you can see it went in very nicely. And if we're in the right place, the medicine goes in very easily, which it is. Doing all right?
I don't feel a thing.
Excellent.
Somebody says don't move and breathe.
They're giving you
Are they
advice.
telling you not to breathe or telling you?
All done.
Wow.
Wasn't too bad, was it?
Incredible.
Yeah.
I didn't feel
Thank you.
anything.
Thanks, Lisa.
Ooh.
Sorry, I was just signing something. Needles, yikes. Is
Needles,
the doctor
yikes.
filming or who? Dr. Vaughan is filming.
Yes,
Dr. Vaughan.
I'm filming while that would be impressive. Let me throw on a Band-Aid here.
So you don't use a local anesthetic like I do.
I do. It was inside.
Oh, you mix them all together.
I do.
It was pre-mixed, so that wasn't air.
Nope.
That was
Lidocaine.
lidocaine. Oh, see, I use Marcaine, and I do them separately.
All right, so what you want to do is just start doing a little chicken wing there and get that medicine moving around in the shoulder there. like I said, that
And you guys are welcome who are watching from home.
numbing medication.
They want to know what it does.
What does? So there's two medications in there. They each have different functions. The first is a numbing medication, lidocaine. The other Dr. Vaughan uses Marcaine. They act pretty instantly, so you should start feeling some relief already. Act pretty instantly, and they last. Marcaine 8 to 12 hours, lidocaine 4 to 6 hours, but they wear off. But the good news is, because they act instantly, you should be walking out of here with a little bit of relief. That'll let us know that it's in the right place and that we're going to get some longer relief with it. The steroid, which we use, dexamethasone, it usually doesn't kick in for 24 to 48 hours. And that's the long-term medication. That's a very potent anti-inflammatory that we put right at the site. So just like you would take an ibuprofen anti-inflammatory by mouth that would go through the whole body and get to the area, this goes directly to the shoulder that's having the issue.
Yeah, we don't do these regularly. At most, a couple times a year, maybe three
Yeah,
at most.
at most every 4 months is my.
Side effects, you can very rarely, if a person was bad at it, they could inject the cortisone into the tendon and damage it.
You would know if that happened.
Yeah, that would take very, very bad technique
How's it feeling?
to do that. And then somebody else asked a question. Oh, somebody asked if you're my partner. Yes. Yes, that's the other Dr. Vaughan.
Yeah.
Sorry. That's Dr. Gawayne Vaughan.
Yeah, so. But it is feeling a little better. How's your range of motion here?
And yes, somebody with an NSAID allergy can receive this. And again, thank you for asking about my mother. She's doing very well. She was fine when she left the hospital.
So it reaches maximum. That numbing medication reaches still have that catch. Yeah, so that'll reach maximum effect about 15 minutes. So 15 minutes from now. But that will wear off. So don't overdo it today.
Okay.
All right.
That means I don't have to lift weights.
No. Yeah, take a day off.
Today's my weight day.
Today's your weight day. Take the day off.
Somebody says it's scary that even the doctor who's last in his class is a doctor.
That's true.
That's true.
I was not last in my class.
I would not say that's scary though, and the reason I say that is because I know what it took to get in there for a guy who was the last.
I agree with you.
They were able to get in.
Yeah.
That's the toughest part.
They were not the last in their class in their pre-med studies, I'll tell you that.
Right.
Yeah.
All right, so you're all set.
Okay.
Okay.
And thank you for joining us.
Urine test.
And those who haven't followed yet, swipe right and follow, and you'll be able to be let in on the follower-only periscopes that may happen in the future.